Okay, awesome. Hello, everyone. It's so great to see some of you, and thank you so much for being here today. Welcome to CFHI's open house. I know that I've had a chance to connect with a lot of you, most likely, but if we haven't yet, I am Mariah Blevins. I am CFHI's program coordinator, so we're really happy to welcome you into this space as you're either, planning for a CFHI program, maybe you're considering one in the future, or maybe you're just doing a different global health experience or thinking about one and are here to learn a little bit today. So I'm just going to pass it over really quickly to my colleague Madeline to introduce herself, and then we'll go ahead and get started.
Hello, everyone. My name is Madeline, and I am CFHI's outreach coordinator. So if you follow us on social media, I'm the one who posts, also send out our newsletter, and I also oversee scholarships. So I know I've talked to a few of you about scholarships, but yeah. So
Okay, awesome. Thank you, Madeline. Just a really quick disclosure. If you are enrolled in a CFHI program, we just want to let you know that there are going to be a lot of other spaces to talk about things like program logistics. We'll have like a health and safety orientation for you and all of that. So this space is actually really going to be focused more on talking about how you can get the most out of your global health experience while you're in country and after you return. So what we'll cover today, first, I'm going to go over a quick overview of CFHI and how we approach global health engagement. Um, we're going to talk a little bit about what to expect from a CFHI program in terms of how to approach it, and also what you're going to gain from participating. And then Madeline's going to talk about different tips for setting goals, skill building, approaching your experience with cultural humility and a reflective mindset, and also how to make the most of your experience in professional settings and how to talk about your experience after you return. And then lastly, we do have a few of our amazing CFHI alumni here who are going to talk at the end of the session a little bit about how the program has impacted them since participating. So if you guys have questions throughout the session, feel free to throw them in the chat. We do have some team members here who can help with answering those. And then also we will do a Q&A at the very end. So we just ask that you save those questions for then. But without further ado, let's go ahead and get started. Make sure I can move my slides. Okay. All right, so first we want to just take a moment and introduce CFHI as the organization hosting this session. So just a little bit of background, CFHI is a nonprofit organization, and we've been offering global health education programs for over 30 years. We currently have programs in 10 different countries, and we offer more than 25 in-person and virtual programs. In the last 30 years, we've sent over 16,000 learners abroad in our programs. So this has really formed a diverse alumni network, and this spans across different academic disciplines, backgrounds, and multiple types of individuals. Importantly, our programs are rooted in long-term community-led partnerships. Rather than short-term service or intervention, CFHI really emphasizes learning from local health systems and professionals. And we really try to approach global health as a space for mutual learning, respect, cultural humility, and reflection. Our goal is really to support participants in understanding the complexities of global health without, of course, reinforcing any sort of harmful narratives, dependency, or inequity, or anything like that. Just a little bit about what makes CFHI unique. We are in special consultative status with the United Nations. We do have a lot of awards in hosting experiential education programs, as well as our work around diversity, equity, and inclusion, and of course, our work in ethical engagement. So we're super excited to be here with you today, and our goal is really to share our expertise with you in global health engagement and hopefully help you explore how you can make the most of a global health experience. So first, let's start by defining global health because this is really going to help us set the scene for the session. According to CUGH, global health is a field of study, research, and practice that takes place or that places a priority of achieving equity in health for all people Global health involves multiple disciplines within and beyond the health sciences. It's a synthesis of population-based prevention with individual level clinical care, promotes interdisciplinary collaboration, and emphasizes transnational health issues and determinants. So what does that really mean? Global health goes beyond borders, of course. One of the main premises is to connect local and global health challenges while focusing on, understanding how social and economic and political and environmental factors shape health outcomes. And at its core, global health really promotes collaboration across cultures and helps build a foundation for ethical, informed engagement in diverse communities. So next, what does this mean for a global health education experience? First of all, these types of experiences are not one size fits all. One probably does not look the same as another. So it's important to kind of learn to identify these differences. And this will also help you understand a little bit better how to approach it. So when designed ethically, global health experiences are often structured. They might encourage reflection and learning that are rooted in cultural humility and centered on local leadership. These experiences, such as one you might experience through CFHI, really prioritize community-led initiatives, and they are really sure to position participants as learners and not necessarily helpers in the community, because sometimes that can lead to inappropriate clinical involvement. They focus on health equity, social justice, and building sustainable partnerships. On the other hand, some programs that might not take an ethical approach or are often marketed as volunteering, missionary work, or service. These might have inadequate preparation or oversight. These might also prioritize the student's experience over meaningful local engagement. This might allow activities beyond participants' training and unfortunately risk reinforcing a harmful power dynamic or the savior narrative that we've seen in the past in global health. So building on, oh, sorry, let me just briefly mention, CFHI has done a lot of work in advancing ethical best practices. It is a movement in and of its own. So if you're interested in learning more about this, or if you're passionate about ethical practices in global health and how to become involved, you're more than welcome to take a look at CFHI's website. We do have a lot of publications that we either were involved in or stand behind, and a lot of resources there for you. So definitely take a look at that if you're interested. Okay, so now building on the importance of ethical global health engagement, CFHI programs are a really great frame of reference as you consider a global health experience, even if it's not necessarily the organization that you're going to be doing this with. CFHI programs really intentionally prioritize learning within existing local healthcare systems and highlighting community assets rather than imposing outside solutions. We really center the experience for you of local and the experience of local healthcare professionals and community leaders. And then we also recognize them as, the narrative of the program and the primary expert in that environment. We also prioritize asset-based engagement and collaborative approaches to promote respectful partnerships and, culturally appropriate activities. And then lastly, we also practice fair trade learning principles. And this really means that we maintain long-standing reciprocal relationships with all of our partners on the ground in the countries we collaborate with. Lastly, participants in our programs are also supported with cross-cultural training and encouraged to really engage in critical reflection throughout their experience, which ultimately helps them deepen their understanding and connect what they learn abroad to broader global health contexts. So these things that I mentioned are just a few things to look out for when you are considering global health experience. And then these will help you, make sure you're practicing or participating in an ethical experience and also being able to take the most away from it. So why does a global health experience matter to you? Your global health experience really offers a unique chance to learn directly about different healthcare systems in global communities. And you're really receiving a different perspective than what you might see here in the US or maybe your home country if it's not the US. These perspectives help mold your identity as, someone who's reflective, someone who is culturally responsive, someone who is able to foster critical thinking and ethical engagement. And also, the experience like this really encourages global citizenship and a deeper understanding of health equity, while of course laying the foundation for, academic growth if you're still in school, or maybe career development or direction if you're still kind of deciding where you want to go with your degree, or in the future if you're considering med school, nursing school, getting a Master of Public Health. And most importantly, it's really a lifelong commitment to, of course, ethical engagement and improving health outcomes and global citizenship around the world. And just to really briefly bring some concrete evidence to this, we like to highlight this particular study, which outlines the perceived weaknesses of domestic health professionals transitioning into global health settings. The study showed that many professionals from higher resource environments like the US, they often struggle with understanding the context and the realities of global health. They also struggle with things like flexibility, adaptability, creativity, cultural sensitivity, and cross-cultural communication. So a global health experience is really going to hopefully focus on these skills and not just gaining clinical skills or practicing medicine, or the concept or notion of saving the world, but rather it should really focus on developing these crucial skills for ethical, context aware, and sustainable engagement. And then lastly, before I hand it over to my colleague Madeline, we just highlighted some of the many, many skills that you can gain in a global health experience. So these include, cross-cultural communication, humility, adaptability, reasoning, critical thinking, thinking outside the box, learning about other systems. So the list really goes on, and there's just so many beautiful things that the world has to teach us. So I'm just going to hand it over to my colleague Madeline to talk a little bit more about cultivating your global health experience and kind of applying it to your future.
Yeah, thank you so much, Mariah. So now I'm going to talk a lot about honestly how to make the most of your CFHI experience. And I think the first step is to embrace the value of ethical global health engagement. And as Mariah covered, CFHI has done a lot of work to design our programs ethically and incorporate all of the components previously mentioned. But it's also really important that participants carry that mindset and understanding as well. Whether you're participating in a CFHI program or through another organization completing some sort of global health engagement, it's important to remember that a global health experience is not really about saving or fixing or helping others. And not to say that you won't be helping others, but the premise is to view this experience as a learner and take advantage of the rich resource of being able to learn from the global health expertise from those in your program location. So CFHI emphasizes an asset-based approach that values the strengths and expertise and innovations present in every community. This is a shift from a deficit mindset, such as viewing communities as underserved or lacking, to one that recognizes resilience and resourcefulness. For example, instead of inaccurately stating, I helped improve healthcare in a low resource setting. That's a really broad statement, and that might not have happened in a 4-week short-term global health engagement. But you can state more of an honest and reflective approach, such as I learned how healthcare providers in whatever location deliver care with integrity and cultural sensitivity in the face of systemic barriers. This mindset builds humility and centers the lived experience of local professionals and communities, which fosters a more accurate and ethical understanding of your global health engagement. Here are some examples of what that would actually look like in practice. So changes lives, as I mentioned with my previous example, that may not happen in 2 weeks. So you saying things like gain insights into local health practice and contribute to ongoing projects. Another one that's really important to mention is a pre-med student had given a testimonial where they said, we were able to suture a patient whose left hand got caught in between a horse and a fence. And that's really alarming to us at CFHI as a pre-med student who's likely an undergrad would not have the training to perform a suture. So what would be more appropriate and more of a scope of practice would be to say, I observed and assisted local medical professionals as they provided care to a patient. So it's really important to reframe the narrative in ways that challenge common misconceptions often found in global health experiences. such as the idea, as I said, as one changes lives or creates sustainable health systems. A lot of these organizations and locations already have a health system in place, and it's impossible, again, to kind of create this in a short-term visit. Again, this also raises questions about, what we're doing and how we're coming in as outsiders in the setting. If outsiders are said to be empowering locals, what is their true role and how does that impact power dynamics? So it's super important to approach global engagement in a way that emphasizes, this is not, don't do this. Approaching global health engagement in a way that emphasizes saving the world often contributes to this power imbalance, which we must work to avoid. So we want to always consider, humility, the local expertise, and make sure that in everything that we're doing and saying, we're focusing on portraying our experience accurately and keeping an understanding of ethical practices within global health. And there's some ways that you can do this. And one that I always really suggest is to set clear goals and reflect often. So this starts, before departure. So set some personal goals. If you're participating in a CFHI program, you do have access to a really great resource, which is our intercultural effectiveness scale. And this will help you. It's part of our pillar of global health, and it's a great tool for this. It will encourage you to think intentionally about areas of curiosity, openness, and emotional resilience. You'll be able to ask yourself, what do I hope to learn from this experience? What challenges am I likely to encounter? How can I prepare for them? As your program unfolds, critical reflection will help you stay grounded, avoid reinforcing stereotypes, and resist oversimplifying complex realities. Another kind of seems simple is journal your reactions to what you're seeing. This is going to help inform your future, experiences. It's something that you can reflect on. The last thing you want to do is spend 4 weeks in this new experience where you're just learning so much, and then you're summarizing it into like 2 short sentences 6 months later, as you kind of jump back into, your studies and those things when you come home. So some of the examples that you can look at when doing critical reflection is like thinking, what, so what, now what, and really writing that out. And this can help make guide your career decisions in the future, help you write personal statements, inform your values, all of those kinds of things. Another thing that CFHI does that I think is a great suggestion if you guys want to submit to and complete a global health education program is we offer what is called a reflection in global health. And what this is a publication that we usually publish, I think, like every 2 to 3 years. And what it has is a bunch of reflections written by students, faculty, professors while participating in global health engagements or about global health topics. And I really encourage you to look at this because it can give you ways to kind of reframe your writing and really capture, a global health experience and think about ways too that potentially publish that in the future. And then again, going back to like what you should do when you're in your program site, and how to like reflect and things that are important. Again, like a key skill is to practice cultural humility and ethical awareness. And cultural humility is not a skill that needs to be mastered. It is an ongoing practice of self-awareness and learning. It means that you must recognize that you are a guest in another healthcare system and they're not to learn, not to lead. It means asking questions respectfully, avoiding assumptions, and honoring cultural differences in health beliefs and practices. I've met with so many students who have gone to different locations and learned about the cultural aspects of healthcare that they hadn't been exposed to in the United States and have been truly moved by that. And at first, they weren't expecting to think that. They were expecting to go into the host location and do a comparison in their mind between like US medicine and this location, thinking in like that deficit mindset. And once they actually got there, they thought of things that they would and hope to bring back from their host country into the US, into their practice of medicine. So CFHI also, as I've said, reinforces the ethical global health engagement, meaning observing and listening and not engaging in clinical care beyond your training or legal scope. So as we shared in that previous testimonial of that pre-med student doing sutures, that will not be a component of our CFHI programs because that is entirely unethical and is an unsafe practice that we don't want to encourage students to engage in. And this is a really vital distinction for us. And along with this, we've done studies and engaged in research where we've learned that admissions committees and employers are increasingly weary of students who overstate or misinterpret their roles abroad. Ethical experiences demonstrate that you understand boundaries, respect for local expertise, and are committed to patient safety and dignity. So now the next thing is to like, how do you talk about your global health experience? Whether this be, in a coffee chat where you're just talking to a friend or colleague or fellow student, or if you're in like a conversational interview or trying to, write it on a resume. So yeah, when your program ends, you're definitely going to want to communicate this in a way that reflects your growth and aligns with what you actually experience. So it's important you can think about like focusing on some of those skills, like Mariah listed that long list of things. So cross-cultural communication, definitely something that you'll be able to be exposed to and learn. Have increased self-awareness, think, understand the ethical responsibilities. And it's important to think of like action verbs and assets-based language that you can use. So you want to use statements like observed, culturally grounded maternal health practices, and engage in dialogue with community health workers in Uganda. That's perfect. You may want to avoid misleading statements like provided care to patients in low resource clinics, because you will not necessarily be the ones that are providing care, as you will always be, someone else will always be leading the care practice, but you'll be there observing and learning from them. And then another thing, when you're thinking about like interviews, which are a little more of a formal setting, go deeper into reflection. Admission officers and employers are not really looking for dramatic stories where it's like suddenly I saved a life while I was abroad. They're looking for maturity, thoughtfulness, and self-awareness. You want to try to frame your experience around specific moments that changed your perspective or taught you a valuable lesson. A good tip I've learned is to use your global experience to tell a story that speaks to the qualifications you're trying to portray. So think about if you're applying to maybe your university's like community healthcare clinic that has a diverse patient population. You might talk about how you witnessed, how other countries may practice medicine if it relates to the population that you might be working with. Some examples that you can give are in Bolivia. I was struck by how physicians integrated traditional healing practices into patient care. It challenged me to think beyond Western biomedical models and appreciate health as a culturally defined concept. So really exemplifying what does it actually mean to be a culturally competent, physician or public health professional. And all of these quotes do come from CFHI alumni. And then when networking or writing personal statements, emphasize collaboration and mutual respect. Show that you're a team player, but not only a team player that can, cross borders and understand different cultural components. So through my interactions with others, I developed cultural sensitivity, but I never saw myself as superior to them. Instead, I learned to value the beauty in our differences. I also gained cultural humility as a result. I will always be grateful to CFHI for this transformation, and I eagerly anticipate traveling to other places with them. So you always, always, always want to center it on learning, growth, and respect for local knowledge. Um, and overall, hopefully, the gist of everything that you got from what I said is a CPHI experience can be a transformative step in your global health journey if approached with intention, respect, and a learner's mindset. It's not so much about what you did, but how you grew and what you learned from it. Preparing thoughtfully, setting goals, and staying open to be challenged, spending time reflecting and reflecting deeply, building meaningful relationships with those that you meet in your host country, and taking time to understand what global health means in the specific context that you are. Global health is a very large concept, but every single country sees it differently. Every single country has different needs and a different understanding of what that truly looks like. And by traveling abroad, this is a very unique opportunity to see that right in front of your eyes. So the insights you gain will not only inform your professional development, but they will definitely shape the kind of health professional you become. And we're here to support you before, during, and after your experience. And we want to be able to help you, offering reflection tools. And we'd love to, once you're done and you've participated, to stay involved in our alumni community. And thanks to our alumni, we have, I think Michaela may not be here, maybe she's here, but we do, I believe, have Nathan, who are going to talk about, I think it's been a year now. I think Nathan participated with me last year or the year before. And he's still involved with CFHI. So that talks just to the value and the impact that a global health program has, and the way that it really hooks you and keeps you around. So thank you so much.
Hey, I'm here too. Sorry.
Perfect. Thank you, Michaela. We were wondering who the other Mariah was. It makes sense that it's you.
Awesome. Okay. Thank you so much, Madeline. That was beautifully said. So the next portion of this session is to hear directly from CFHI alumni about, some of these topics that we have been discussing. So we have a few alumni here. On this slide, we have Michaela, who did our program in Tarija, Bolivia. And then we also have Nathan, who did our program in Mukono, Uganda. So I think we can just maybe go one at a time. And then we have some questions for some prompts for our alumni to answer. But of course, if anyone has any specific questions for our alumni, feel free to throw them in the chat, and then we will do like an official Q&A afterwards. So Michaela, do you want to go first?
Sure. Let me just turn on my hi all. Can you see me? Okay.
Yeah, so good to see you.
Yeah. Let's see. Briefly describe my program. So I was in Tarija, which is a like small town / small city in Bolivia. And I'm a fourth year medical student, graduating in May, just to give you some context on that. I think for me, I took 6 years between college and medical school. And one of the things I was in the Peace Corps in Dominican Republic. So I think my experience in Tarija was slightly different because I had spent 2 years in like a very rural area with few resources and only Spanish speaking. So coming to Tarija was like super comfortable for me. But I think what I wanted to really get to know was the way that the health system works in Bolivia, and continue to strengthen my Spanish and also have like a different cultural experience and kind of bring that back with me. And I think in general, skills showing up, I think the biggest thing is just like learning from the people you meet, honestly. Like you're gonna learn if you're going into medicine, you're gonna learn like those basic things, but it's kind of learning from those around you. I think particularly to Tarija or Bolivia, for example, is they have indigenous medicine embedded within their practice of medicine. So you can prescribe indigenous, or I guess maybe in the US would be called like alternative like medicines. So a big thing was manzanilla, which is chamomile. They have that in like every single medication, whether it's something you're putting on your body or like ingesting. And so really to see that sort of integration of like that belief system with sort of this typical like Western science was pretty cool, and I think eye-opening, especially if you're going to be serving a diverse group of patients. You're not always going to be able to like lie back on your very scientific medical training. Let's see. Moment interaction that shifted how my view of global health or medicine. I think honestly for me, it's sort of, again, going back to the people I meet. Like, I just remember, I think one of my favorite afternoons was a Sunday where I was just helping prepare food in my host family's home. And being able to sort of just talk about our lives with each other, and you realize how much you have in common as well as how many things are different. And I think that like basically you're like figuring out the sort of similarities in humanity in everyone, and that goes across the globe, and I think it makes the world a little bit smaller too, in a good way. Yeah, I would say that. And then let's see, I think that in terms of how it's going to make me a better provider, again, having that cultural humility, being able to just interact with the different people, being able to see different perspectives. It's hard to see different perspectives when you've never encountered that perspective to begin with. And I think that this program can also do that. And no matter where, in your training, you're going to come up against even medical providers that have different perspectives. But I think really my experience in Tarija also just reinforced that. I would say in terms of advice, like going into it, just be open-minded, just, understand like that your view is just that. It's your view. No one else sees through your lens. And that's just a fact, whether it's like, even if it's someone you're super close to, like your partner or your brother, or, best friend, you still are the only person that believes exactly what you believe. And that's just based on your life and your experiences. So just keeping that in mind, and yeah, being open. I think that's the biggest thing.
Beautifully said. Thank you so much, Michaela. Okay, let's go on to Nathan. Do you want to go next?
Yeah, can you hear me okay?
Yes, good to see you.
Yeah, you too. It actually logged me in as Mariah Blevins also, so I'm glad I'm not the only one.
I'm so sorry. It must be because I shared the link with you all, so I everyone's me now.
That's okay. We can be Mariah today. So yeah, I'm Nathan. I did my CFHI program last March to April in Mukono, Uganda, with an organization called OmniMed. I actually left Uganda exactly a year ago today. So this is good timing. But I was there, I guess kind of the purpose of my trip originally was to complete a practicum project. I was finishing my master's degree in global health from Northwestern University, and we had to do a field-based practicum as kind of our final project to wrap things up. So I was connected to OmniMed through CFHI, mostly because OmniMed has a big focus on sort of community-based approaches to healthcare and all sorts of things. And what I was specifically interested was mental health. And OmniMed had started working on a mental health program that used community volunteers essentially to address mental health issues in a village setting of Uganda. So I was there. My project kind of changed a few times while I was over there, which I guess is a major piece of what I learned from my experience is just adaptability, flexibility, kind of, to not go into this experience with any sort of preconceived notions of what it's going to be like and to be able to be flexible and kind of be on your toes and figure out what the needs of the community that you're working with are and figure out how you can align with those things. A major thing that kind of really stuck out to me with my program was, I guess it was a couple things really. I was working on a mental health program or project, which in a very basic sense really kind of challenged the way that I define mental health as a whole. My project was focused on the intersectionality between income and poverty and mental health, but in a lot of ways, mental health is not addressed in other areas the same way it is here. One example of that is that sometimes people would describe sort of mental health symptoms or like characteristics of well-being in more of like a physical sense, which is not something that we're used to. People wouldn't talk to me as if they're sad or depressed or anxious. It would be more of like I'm in pain or, you know, just sort of different way of defining what mental health is and how we really recognize it within ourselves and within our neighbors. I think another major thing that I learned from this program was that kind of fostering interpersonal relationships is super important and can also be really, really impactful when you're trying to implement interventions that are maybe new to communities. So, and I see a question in the chat there about social work. I think kind of my background, so I work in homeless services. I am in charge of implementing a housing first model of shelter providers, but also community-based sort of housing work in Denver. And this program for me really kind of opened my eyes into how being creative and addressing certain things from a community perspective can be more impactful than sort of our traditional ways of thinking. So moving forward since my project, I think what I've taken away from it the most is that if we can foster interpersonal relationships between people who are going through similar experiences, it actually can be a lot more impactful than just trying to put resources directly in front of individual people. And so we've tried to implement that back at home. I've found a lot of parallels between my experience in Uganda and what I do here. And it's kind of changed our approach a little bit. We try to connect some of our clients who are going through the same issues and form support groups and allow them to kind of talk amongst themselves about what are some creative solutions to overcoming those barriers rather than our case managers or our programs just trying to put stuff in front of people. So from a professional point of view, I think that's been the biggest thing that I took away from this experience. Any advice I would give to students who are about to do a CFHI program, I would say really be reflective while you're there. I think for me, a big challenge was that I had so much more free time in Uganda than I do at home. And I didn't really know how to process that or what to do with it. I also, yeah, like I said, had to be super adaptable, very creative. My project changed several times while I was there. Our focus changed. there are different priorities in different communities that I've never experienced before. So, for example, there was a funeral in the village nearby one day, and everybody went. So all of our plans for the entire day had been canceled, and everybody as an entire community came together. There were hundreds of people at this funeral, including me, that, something like that wouldn't happen at home. So just be adaptable, be ready for that, take in the experience. Every single day is an opportunity to learn when you're abroad. So make the most of it.
Amazing. Thank you, Nathan. I think your experience totally just talks or speaks to the fact that, the world is our teacher. It is super interesting to hear about your experience also compared to Michaela's as well, since Michaela's was a little bit more focused on hospital and clinic medicine, and yours was a little bit more focused on like community health and community medicine. So it's super cool to have both of your experiences. I don't know if someone's unmuted. Okay, I think it went off. So we have two more alumni here. I'm going to pass it over to Sarah, who did one of our programs in India. And then lastly, we'll hear from Roya, who did our other program in Uganda.
Hello, everyone. My name is Sarah. I participated in the Dehradun and Rural Himalayas program in northern India back in early 2023. So this program was based mostly in Dehradun, but we went to a couple of different places up in the Himalayan foothills, including Mussoorie, and then we went to some other places on the weekends as well. And at that time, I was an undergrad junior global health major. And now I'm an MPH student, so we've definitely grown a lot from there. For global health skills that I developed during that time, I feel like I really was able to put cultural humility into practice and also adaptability as well. That was my first ever kind of more immersion global health experience. So I had no idea what to expect, and I just wanted to go in with as much of an open mind and kind of a sense of flexibility as I could, since I knew that I was going to experience a lot of new things while I was there and learn a lot. So I think that I think I was really able to work on being able to adapt and be flexible. Um, and then for how the skills show up in my life, career, education today, as mentioned, I'm now a master's of public health student studying epidemiology, but specifically global health epidemiology. So my program currently has a focus on learning and working abroad in the future. And I'm going to Ghana this summer for an internship. And I feel like a lot of the skills that I learned and was able to apply from my time in Dehradun are helping me out currently as I prepare to do more traveling for global health, as well as when I am in these experiences like in person as well. For a specific moment that shifted how I view global health or medicine. This is hard because I had so many amazing experiences when I was in Dehradun. But the final week that I was there, we originally were supposed to be going to a rural village to help on a community health project. But kind of as mentioned, you have to be flexible. And the day before we were supposed to go, we heard that the person who was going to be leading the trip had an immediate family member who passed away. So our local coordinators worked really hard to shift around the experience to still give us something that would be really supplementary and important this last week, but something that could be planned in the short amount of time that we had. So my group ended up going to a school for disabled children in Dehradun and getting to shadow there and learn about healthcare access for disabled people in northern India, which I think was a really unique experience. We got to connect with a lot of people, a lot of the teachers and medical and educational staff who were there, and really learn about this subsect of global health in this context. And we also got to talk to children and families as well about different health realities that they faced in their everyday life. And it was a really enriching and meaningful experience, and was one of my favorite parts of the 4 weeks that I was there too, and was something that was completely unexpected from the beginning. It was not on our original schedule at all, but I think that that experience not only taught me about being able to adapt in unexpected situations, but also a different aspect of the healthcare system there that I had not learned about previously in the 4 weeks that I was there. For some, let's see. Oh, I almost skipped a question. So I think that this experience definitely made me more apt to want to study and work in global health in the future. It taught me a lot about not only different healthcare systems across the world, but also collaboration with others, how different systems and bunches of teamwork work in different settings. It taught me about different resources and their availability in different settings, and how different cultures and communities adapt. I just feel like I learned so much from it that I hadn't gotten the chance to learn in my studies in the United States before. So I was just really thankful overall for the experience, and ready to learn more in other experiences that I was presented with in the future. For advice to make the most of your time abroad, this kind of goes off of what I already said, but really go into your experience ready to learn and experience and soak up as much as you can. As much as we can prepare for going abroad before we do so, by watching videos, by doing lots of research, reading articles that are relevant to specific health topics that you're looking to study. Nothing can get you more familiar with these than being there in person and really experiencing for yourself. So make sure to go in with an open mind. Try not to have preconceived notions before going into the experience, and just be ready to kind of be like a sponge and soak up as much as you can in the moment while you're there. That's how you're going to get the most out of it. In all different ways, academically, professionally, and personally. I think you're going to take the most home from that just by going in ready to experience whatever's thrown at you. Obviously, do some research beforehand if it's somewhere that you haven't been before, a different context that you haven't immersed yourself in, but be ready to expect the unexpected as well. I think that's how you're going to get some of your best lessons and memories out of it.
Thank you, Sarah. Totally agree with that. A lot of things, or a lot of times in experiences like this, what you get out of it is what you also put into it. So, definitely appreciate your perspective. I always love hearing about your time in India. Okay, lastly, while we're wrapping up here, we have one more alumni here. Roy, I'll go ahead and hand it over to you.
Hey guys, thank you. Hopefully everyone can hear me. I'm Roya. I'm a surgery resident. I'm a first-year resident, and I went to Kabale, Uganda about a year ago in February of my M4 year. It is really weird that a whole year has passed. It was like truly one of the best experiences I've ever had. Kabale, Uganda was like a rural, I guess, like a rural town in Uganda. I really wanted to, I guess, get out of my comfort zone and see a part of the world and experience people and a culture that is very different from mine. So that's one of the reasons I chose there. And I also wanted a more rural experience. There were some locations in like, I think Cape Cod, South Africa, or like Accra, Ghana, that didn't provide as much of a rural experience. So that's why I chose Kabale, Uganda. What skills do I feel like I developed? I think it's, as everyone has said, like adaptability and flexibility were huge. Though it was a very like special and meaningful experience, it was also really challenging. Like every day I felt uncomfortable for at least a few hours of the day, even though, and I was loving it the whole time, and also, most people speak English in Uganda. Um, and so I didn't think that the language barrier would be an issue, but there was just like a cultural language barrier that I didn't expect, and it's hard to describe, but I felt like, despite the fact that I was speaking English to all these like local Ugandans, back and forth, we still like didn't quite understand each other, and there were all these barriers, and from like they use English words to mean different things. It just was a lot of like patience required of me and learning. And I also was the only American and only like CFHI person on my during my program, which made it really cool. It was incredibly immersive, but I also felt like always an outsider, and you just feel like in a location like rural Uganda, they're not used to seeing many white passing people. And so you really stand out, and you feel watched all the time. Things like that were like, I don't know, exercised my flexibility, adaptability, and just like level of accepting discomfort. I just knew it was going to be 4 weeks of like an uncomfortable experience sometimes, and that's just going to be like what it is. It's still really cool. Also, just of course, like learning how to connect and bond with people who live such different lives, but are like, at the end of the day, very relatable and beautiful people. Today, I mean, I'm in a pretty like well-resourced community hospital doing my surgery residency, so I don't feel like my skills are necessarily like that much communicating to my day-to-day, but of course, just learning how to empathize with patients, and I guess the main way that my experiences impacted me in my career is that it was the most inspired and like career driven I've ever felt, more than any rotation in med school. I think it really like opened my eyes to, this is what I want to do. This is like why I went to medical school, and where I see myself kind of being fulfilled career wise is working with international populations, doing some sort of like global surgery, or maybe like Doctors Without Borders or things like that. So I feel like it's important to every now and then reflect on like why I'm doing this, because residency gets very tiring sometimes, and just kind of like you can feel jaded. So it's been helpful to like keep my eye on the long-term goal. What else? A specific moment, there were so many. Nothing like specific stands out, but I think seeing how the clinics and hospitals worked was really fascinating and eye-opening. Like going to medical school in the US, I feel like everything was so detached from like the roots of medicine and healthcare, in the sense that like my whole 4 years in medical school, I didn't even know like what happens when you send labs off for a patient, like who's collecting these labs, and who like what's happening to these labs, or what happens when you send off a urine culture. I don't even know where the like microbiome lab is, or is it in the building, those kinds of things. Whereas just walking around their small clinics, it's in Kampala, Uganda, it was incredibly like tangible, I guess. Like there would be the microscope right there, and you can look under a slide, and the whole lab is run by one person, and he was so friendly and would just like walk me through everything. And so I would go talk to a patient, and this patient has a cough or some sort of illness, and you just get a sputum culture, which means you can like bring that tube back to the next door, and then the person running the lab would just show me like how they stain the specimen, or how you put it under the microscope and literally look at it. And I remember like seeing malaria and seeing various like TB and things like that under the microscope, which was just like reminded me of how cool medicine is. And sometimes we kind of lose this aspect of it in the hospital where you're just working under like behind a computer. I don't know if that makes sense, but I feel like it just brought me back to like the basics of healthcare. And what else? I think it was also really cool working with and being around local medical students. Where I lived was kind of like a complex of housing units, I guess, and I lived with local anesthesia students, and so after our work day, we would all like play soccer on the grass and just like talk about our days and talk about the differences in our hospital versus their hospital systems. And I think those kind of like cross-cultural interactions are so beautiful. I'm still like think of all my friends there really fondly. I feel like I made a beautiful family there and I miss them a lot. So that was also just like, I think it's really beneficial to be so immersive and to have not been like surrounded by other CFHI people and not like immersed with the local students. I feel like I said, I don't know, make me a better future provider or health professional. I feel like it's important to value different ways that like nations or cultures practice medicine, different ways of life, like everything in the hospitals system was different. People, just from like how people manage waste and their like versus our consumerism culture and our incredible like disposability culture. I feel like that was very important to see, like not everything that we do in the US is right. I think a lot of people in Western cultures have this idea that like we have money and we do things the right way. And it's like, I think it's important to go elsewhere and realize how different and maybe better and like just special other ways of life can be. And also that we can do things differently. We don't need to like, I don't know, don't need to order all these tests on patients when you kind of know what is going on, or you don't need like imaging if you like don't necessarily need that imaging. Just kind of use your brain and examine the patient, things like that. And my advice would just be to like really think about what you want out of your experience and don't be afraid to put yourself out there. I was like very nervous leading up to my trip going to Uganda, and I feel like spending 4 months anywhere, or sorry, 4 weeks anywhere is a big deal to me, maybe to other people, being away from home, especially in Uganda, but I'm so glad I did it. I feel like no matter what, you're going to grow and embrace the discomfort.
Thank you so much. That was so wonderfully said. And yeah, just like the other testimonials we received from the other alumni, I feel like you did really speak to just how the world can teach us so many amazing things. And, we mentioned a little bit earlier, one of the practices of ethical engagement is not to come in with these preconceived notions. I think it is a common misconception that just because, higher income countries have more money, there's a conception that maybe we do things better or things like that. But going to another country is so vital to, learn about different resource allocation and resourcefulness when you are in a limited or resource limited setting. And in turn, it teaches us that, there's different ways to do things. We all know that the US healthcare system is not perfect by any means. So super great that you guys were all able to get that kind of cross comparison lens and perspective. That's all we have for the alumni, but I know we only have a couple minutes left, so I would love to just open it up to anyone in the meeting. If you guys have any specific questions for any of the alumni who are here, or either myself or Madeline, yes, please feel free to type in the chat or unmute and we can take care of those questions.
Hi, Roya. I have a question for you. My name is Daniel.
Hey, yeah, sounds good.
Hey, I was just curious, kind of logistically. So I'm in my third year of medical school, and I will be joining in a trip to India in February of my fourth year. And I wondered just kind of logistically how that worked for you, if it was good timing with the match coming up, and just all of those kind of things, and how it flowed with kind of third into fourth year and all that kind of stuff. If you would just talk about that real quick.
Yeah, awesome. Um, I I did it in February. I thought that was a really good time. It was like one of the only months that would work. It was either going to be that or like post match, like April or May, but May was graduation. And so I chose February because my interviews were done. And I know that you have to like rank, do the ranking in February. I didn't know how my internet access would be, and like that sounded stressful. And I came back March 1st, which is like after the ranking is done. So I just ranked on the very first day it opened, February 1st, the day that my flight left, and then I left to the airport. That all worked fine. I feel like that's a month that I didn't need communication with programs or program directors. I just sent like all my thank yous and stuff before. And it was really cool. I think it was a great time to like shut your mind off. And then as soon as I came back, like, 2 weeks later, the match happened and everything. Also, by that time, I just kind of had done most of my requirements. I think I had like one other required thing for med school in March or something, and like a few week elective in April. I did get credit for just like a random, like some clinical credit. So try to get credit if you want. I think that I needed that like clinical credit. So you should like look ahead. But in terms of specific rotations, of course, it didn't give me like an ICU rotation, or it didn't like replace like an internal medicine thing. I would talk to your advisor and see what credit you can get for it, but you'll likely be able to get just like some 4 weeks of clinical credit if you need. And yeah, my med school was very like kind of hands off, I guess. I just needed to fill out a bunch of forms, and ideally I would have gotten some like funding, but that didn't work out. So that was kind of the main thing. But I feel like just make sure your graduation requirements are set and your rank list is in. And then it was a really great thing to bring up during my interviews, because I would mention like I'm really interested in global surgery, and I haven't been able to do anything yet, but I'm very excited to go in February. It would be cool to have had the experience before so you could talk about it. But I think either way, just showing that you're engaged and driven, like self-driven, is great. I don't know if that answered your question or if you have any other questions.
No, that was awesome. Yeah, thank you very much.
Daniel, I will add, I feel like that's actually a really popular time. Like we have a lot of students that tend to participate like between that window of time before they match. So that we actually do see a lot of students do that.
Oh, cool. Okay,
Mhm.
great.
And if you have any reason why you might need connectivity, like we can kind of like brief you beforehand. Like in India, I don't think there's a time. Like actually, Sarah could talk to this more, but like I don't think there's a time where you wouldn't have access to Wi-Fi. But Sarah can correct me if I'm wrong. But you feel free to like let us know of those things, and we can do our best to accommodate it.
Cool. Yeah, and getting the rank list in before, like knowing that is like clutch. Thank you.
Daniel, are you going to Dehradun or Delhi for your program?
The rural one that you did, yes.
Okay, perfect.
Yeah.
So, I was an undergrad when I was there, but another girl on my trip was a fourth year medical student who was like getting placed at the time. And while we did not have Wi-Fi at our host family's house, but the local coordinators were very flexible for when she needed to be checking her email or like sending emails or even like doing any meetings or anything. And they gave her a bunch of different locations close by, like cafes and things like that, that had reliable Wi-Fi that she could go to. And if it conflicted with any of our rotations, she was able to go to the place with Wi-Fi whenever needed, because they, of course, this is a medical kind of based program. They understand how important like getting your placements and everything is. So they will make sure that, if you need to leave somewhere to check and send emails or anything for this, they'll make sure to help you out with that. Just make sure to communicate it with your local coordinators in advance. But yeah, they are very ready to help out with that too.
Cool. Thanks. Yeah. Communicate, communicate, communicate. Thank you.
Definitely, that's like key. And please do reach out to us with questions. I think Vanessa has asked a few questions. If you're in like a gap year or still trying to figure out what you want to do, so you're like working and not enrolled in school currently, you are more than welcome to apply. Like a lot of our wording is catered around like learners. We do accept people not currently enrolled in school. So
Okay, awesome. I just for the essence of time, will let our alumni who are with us go because I don't want to keep you too long. Thank you all so much for being here. It was super amazing to hear about your experiences again and just get your insight on how to make the most of a global health experience. I also will throw out here that we do office hours most Fridays at 10 a.m. to 11 a.m. Pacific time. So feel free to scan that QR code and register. It's a better space to talk about, logistics and, just general program questions if you have them. So feel free to do that. But yeah, I will stay on for a few minutes as well in case there are any last and final questions. But thank you all to everyone who is here today, and thank you to the alumni as well for being here.
Thank you very much.